Well, hello, everyone. I want to welcome you to this session, this panel discussion on the title is Training the Next Generation of Global Health and One Health Professionals. My name is Dr. Gerald Parker, and I am the Associate Dean for Global One Health at the College of Veterinary Medicine, and also the Director of the Pandemic and Biosecurity Policy Program at the Bush School of Government and Public Service, both at Texas A&M University. We have an outstanding panel lined up. I'm very honored to serve as their moderator to discuss issues related to educating and training and bringing on the next generation that'll follow us. I will start the introductions. Our first panelist is Dr. Eeny Iditiris. She is a former Vice Chancellor and Professor of Avian Health at the University of Putra, Malaysia, and has been actively involved in research related to the control of avian respiratory and immunosuppressive diseases and development of poultry vaccines and rapid diagnostics for Newcastle disease, fowlpox, avian influenza, and mycoplasmosis. In 2013, she was the only Asian inducted in an inaugural member of the World Veterinary Poultry Association Hall of Honor and went on to serve as Vice President of the organization. Dr. Eeny was elected Fellow Academy of Sciences, Malaysia, Founding Fellow of the Malaysian College of Veterinary Specialists, Fellow of the Malaysian Scientific Association, and Fellow of the Malaysian Institute of Marketing. She is also a Fellow of the Islamic World Academy of Sciences. She is currently the Council Member of Academy of Sciences, Malaysia. Eeny served as numerous leadership roles at UPM beginning in 1992 and culminating in her being named the 8th Vice Chancellor in 2016. Since January 2021, she opted for full retirement as involved in various national and international organizations. Our second panelist is Dr. Jonah Mazett. She is a professor of epidemiology and disease ecology in the UC Davis One Health Institute in the School of Veterinary Medicine. She is co-director of the USAID's One Health Workforce, Next Generation, an educational strengthening project empowering professionals in Africa and Southeast Asia to address complex health threats. She is a member of the U.S. National Academy of Medicine and serves as the Academy's Forum of Microbial Threats and One Health Action Collaborative. She was appointed to the National Academy Standing Committee on Emerging Infectious Disease and 21st Century Health Threats, which was created to assist the federal government in critical science and policy issues related to COVID-19 and other emerging health threats. Our third panelist is Dr. Wilson Gabreus. He is a Hazel C. Youngberg Distinguished Professor and Executive Director of the Global One Health Initiative at The Ohio State University. Dr. Gebreyes has led several programs funded through the NIH, the CDC, USAID, Gates Foundation, and among others. He serves in international advisory capacities for various governments and review panels and other entities. Dr. Gebreyes leads a global capacity building initiative addressing international issues at the interface of humans, animals, plants, and the environment. Dr. Gebreyes is the recipient of the APLU Michael P. Malone International Leadership Award, the NIH Gold Medallion, University's 21st Best International Model, North Carolina State University Distinguished Alum, Andrew Haskell Award, and by the Institute of International Education. Recently, Dr. Gebreyes was inducted to the newly established American Academy of International Education. And our fourth panelist is Dr. Shawn Gibbs, who is the Dean of the School of Public Health at Texas A&M University, where he also leads the university's COVID-19 response efforts since January 2021. An industrial hygienist with expertise in disruption of highly infectious diseases, his research has helped determine national policies, procedures, and best practices for responders and healthcare workers to safely treat patients with Ebola, COVID-19, and other highly infectious diseases. Dr. Gibbs is a member of the U.S. Environmental Protection Agency Board of Scientific Counselors, Homeland Security Subcommittee, and has worked with the U.S. Department of State and the U.S. Air Force Air Mobility Command. Dr. Gibbs is a recipient of the American Industrial Hygiene Association's Edward G. Beyer Technical Achievement Award, Biomedical Research Exemplar Award, and U.S. Fulbright Faculty Scholar to Egypt. He has led 3 institutional Fulbright Scholars training programs for public health curriculum development. So I think you can see that we have an outstanding panel to talk about One Health, global health, next generation educational and training needs. So I'm going to start with some questions for our panelists, and I would like to first turn to Dr. Ideris, who has done quite a bit of work with the Malaysian One Health University network. And so I would, first maybe pose a question to Dr. Ideris and what her perspectives and what she has observed and learned as we try to introduce One Health concept and applications to students and some of the competencies needed for educating our next generation of One Health. So Dr. Ideris.
Thank you very much, Dr. Parker. Very good morning to everyone. It is 12:05 a.m., 13th of March in Malaysia. So I'm very happy to be here. It is an honor for me to join the panel today to talk about One Health. And in Malaysia, we have the One Health network, which was initiated in 2012. That was about eight years ago, and which is a part of the network for Southeast Asia University Network of CUGH. And under CUGH, there are 8 countries involved: Malaysia, Cambodia, Indonesia, Laos, Myanmar, Philippines, Thailand, and Vietnam. And where Malaysia, Indonesia, and Thailand and Vietnam are being the founding country in the network of CUGH. Just a little bit of the background in that. And we find that in terms of the learning and for students to go for training into One Health, the students, as we are aware, they have for veterinary students and also for medical students, they learn zoonotic diseases as part of the thing in their curriculum. But this, recently there are many of these zoonotic diseases, and some of those are pandemic diseases. And in Malaysia, we experienced a very bad one, Nipah virus disease, which killed many people. And in that situation also, our pig industry actually went down very badly, because we had to kill all those. We had to kill all those affected pigs in order to control the Nipah virus. So since then, the country realized the importance of working together, collaborating together with various agencies, with the government agency, with the industry, and with the universities, of course. And this One Health comes very timely. The network of One Health network comes very timely, because it creates a lot of interest for the other agencies to work together. And now also with COVID-19 coming in, people are very much aware about the need for the One Health for various agencies to work together. And in Malaysia, under the One Health group, we have 17 universities, private and public universities, that come together. And we also have the ministries, the main ministries, many ministries are involved, but the main ministries being Ministry of Health, Ministry of Agriculture, and also Ministry of Environment and Natural Resources. These are the ministries involved. And besides some other research institute that are associated with the One Health, we have a very important agency, which is called a National Disaster Agency, that looks after or play a big role in the management of pandemics, as well as the any disasters that comes along. So as far as the students are concerned, under the One Health group, we have students, we introduce the student to the concept of One Health, besides the zoonotic in their curriculum. Now 8 of the universities has formed a One Health Students Club. And under this club, they do a lot of activities, the various activities that involve communities as well as the school children, to give awareness to them. And that also helped to create awareness to our students. And at the same time, the training, we do the training for the students as a pre-professional level, but at the same time, we also do a lot of training program to professionals, the in-service people. I think now we have under the MyHoon, there have been more than 100 workshops or training programs that have been carried out. Students go to the community, staff go to the community, and they learn from each other. And I think that's how we create their interest. And we also have looked into curriculum. The veterinary faculty at the Universiti Putra, Malaysia, where I come from. We have already developed a 2-credit course on One Health in order to enhance the training for the students. I think that's for now, Parker.
Yeah, thank you. And we're going to circle back to a couple of themes you brought up, but I want to make sure our other panelists get an opportunity to also have some opening remarks. But I also want to remind all the participants, if you have a question, please type in your question in the Q&A box at the bottom of the screen. And we definitely want to make sure that we have time to go to the questions from all the attendees who are participating today, which we actually have close to 200 participants, attendees, so that's great. So please throw us your questions at us. So Dr. Mazet, I wanted to go to you next, and I think both of us, all of us on this panel, we've probably been beating the drum for quite some time about the threat of emerging infectious diseases, and we were certainly forewarned about COVID-19, but I'm not sure we were greatly prepared as we should have been or could have been. But emerging infectious diseases have been increasing outbreaks with alarming increased frequency, and many of us been talking about the need to be at this interface between the animals and humans and try to mitigate spillover events. But your career has been right at the nexus of this. But with your perspectives and recognition of the importance of One Health and this human-animal interface, I want to kind of get right now to the educational aspects of this. And one question that I have is, do you believe, that has the academic community actually been able to keep pace with this growing challenge and problem that we have with emerging infectious diseases? And perhaps you can even expound on some of the work you've done with the national academies in this regard. So, Dr. Mazet?
Thank you. So I think there's a couple things there. One, as far as academia keeping pace, I think academia started this One Health movement, right? And brought sectors together. But maybe we all need to acknowledge that we're not as good of communicators in some of our disciplines as we could or should be. So I acknowledge that myself for sure, that while I've been working in emerging infectious diseases for a couple of decades and the One Health approach for maybe even longer than that, but that we've done our best, we've waved the flag, but maybe we could do even better yet, as we like to say in teaching, that we need to really increase our collaboration with the communicators, with people who understand neuroscience, with people who understand how people make choices like behavioral economics. So I just want to throw a little shout out there that we can all do our bit, but we need to really embrace fully the One Health approach and look across disciplinary lines even more richly, maybe than we have been in academia. With that, I could transition a little bit to your question about what's happening in academia. Are we training people? Are we making sure the next generation is ready to tackle these big, difficult, complex problems like pandemics? And I think we've seen an enormous amount of growth. So with the national academies, as you mentioned, we did do a couple of big efforts to try and evaluate this. The first was a multifaceted investigation, including surveys, but also direct call outs to universities, checking in with them, searching all their web pages. In the US specifically, because the US National Academies, our first effort was to see what's happening in One Health education. And what we found, and we did this, we finished this up a couple of years ago. So forgive me if anybody has started a new program in the last year or so. But what we found were that we could identify within the US 45 One Health academic degree programs. So that means that their program emphasized the One Health approach or specifically named One Health, and we're looking at multi-sectoral disciplinary interactions. We found those programs to be in half of the US states, so almost exactly half of the US states have at least one Health academic degree program, 22% at the bachelor's level, 60% at the master's level. So that's where the majority of the new programs or the One Health programs live, in that sort of level, and then 18% at the doctoral level. And we did find ones that went back all the way to the 60s. I'm proud that our institution, as well as CDC, were thinking and working back that long ago, but the vast majority of these programs that we identified have come up since 2012. So that's where we really saw the peak of those programs being established, and I think that's really great news. Some of the core areas that we identified that are well represented included epidemiology, environmental health, and ecology. Key areas that we identified that were less represented and need to be increased were planetary health, interestingly, antimicrobial resistance, and law and policy around One Health. Zoonoses, which most people put as the primary, poster child, especially now for One Health, were actually identified in less than 50% of the programs. And food safety and food security, incredibly important, we're actually in the 50 to 75% range for the program. So I think that's really, really interesting as well. Since then, we have gone out, again, with the National Academies behind us, we have gone out and done a workers survey. So we've surveyed now all over the world, and we've looked at students in One Health programs, their perceptions, challenges, successes, compared that to the workforce, workers in One Health already who consider themselves in a One Health job, and those job seekers, as well as employers. So we have been able to look at what people, both the employers, the workers, and the students feel their training was most important. And interpersonal communications with scientific and non-scientific audiences was #1. And I think that's really important, back to my first point, that that's where people feel they need that training and need even more of it. #2 was the ability to build, work in, and manage a transdisciplinary health team. So those were consistent across all sectors. Graduates, job seekers, workers, and employees all thought those were the #1 most important thing. Now, when we get past those top two, it starts to get a little bit different. And I think there's some rich content around what employers think is important versus what the trainees think is important. And if we have time, we can get into that later. And I'd love to share with you some great examples after the other panelists have a chance.
Sure, and thank you. Real quick, within a university setting, which colleges were more apt to have some of the degree programs in One Health?
So, you're pushing my buttons, but it's veterinary schools start, right? So veterinary schools, definitely, then colleges of ag and public health. And then we start to see a differentiation, only one in a law school. But I was really excited to see that one in a law school.
Yeah, that is exciting. Maybe we can unpack that a little bit later. So thank you. So I would like now to go to Dr. Gebreyes, and Dr. Gebreyes, you've done a lot of work, and I apologize, my dog is in the background, but I'll go on mute in a minute after I get the question out. You've done a lot of work in international capacity building, and in that context, I know that you've also worked with a lot of students in training and education on the international stage, as all of us have. But I think in your efforts with that capacity building, what are your lessons observed at the moment? How we can make sure that the things that we're doing in capacity building are sustainable and not just something that we go in and train, but they're actually sustainable and long lasting. Any thoughts there?
Great. Thank you so much, Jerry, and thank you for inviting me. A great organization for the CUGH 2021 team. I think that's a great question and great prelude from both of my colleagues, Aini and Jonna. I think first of all, we all have to have a deep recognition of how interconnected and increasingly more and more interconnected our planet is becoming, right? So just this year, about 140 million babies are expected to be born. That's more than 1/3 of the United States population. With all that, in fact, the umbrella United Nations Sustainable Development Goals and the need for One Health, and as a university ourselves and as the builders of capacity of the future professionals, I think we have a lots of role to play. And when I say we, it's not just a few health science disciplines, but as Jonah mentioned, really this is a truly transdisciplinary and broad way. In our case, just before I give you the examples of what makes sustainable models, we have 13 of our colleges involved within Ohio State University, beyond the 7 health science colleges, including business, engineering, social sciences, agriculture, of course, and others. I think that interconnected, disciplinary, multidisciplinary, or transdisciplinary nature is critical. Secondly, of course, as university, we all aspire building the successful future professionals. Therefore, our vision and focus in our Global One Health initiative and what we always advocate is how do we build capable professionals, but also beyond that, resilient institutional systems that will be really critical to advance healthy and enduring global communities. And we know with the current planet being smaller, and COVID-19 is an excellent example, anything we do internationally, it hits home. As a land-grant university, Ohio State or UC Davis or any of us, what we do internationally is not just about that country. It's really, we are very much closer to each other than the actual mileage between some countries, right? So many of the infectious diseases, but also I think we also have to recognize beyond the biological hazards, the need for chemical hazards and environmental hazards, non-communicable diseases. So our capacity building effort emphasizes, as Jonah said, it's beyond zoonosis, yes, even beyond antimicrobial resistance is the other, the low-hanging fruit examples, but how do we get professionals, disciplines engaged in the non-communicable diseases, chemical hazards, cancer, others? For us, that is really the bridge of global one. And so we strongly believe creating that transdisciplinary, what we do international with a local mutually beneficial capacity building system is critical also to sustain our success. We have few short and long-term models. One flagship program we have been doing since 2012 is, for example, Summer Institute. That Summer Institute involves a large number of Ohio State faculty, students that do service learning, summer research projects, travel to East Africa, travel to Brazil, travel to Thailand, and get this really transformative knowledge gaining. At the same time, we also provide short-term modular trainings in diverse sets of courses. I think between 2012 and now we have about 2,900 trainees. Some of the examples like for US students is our College of Business has global applied projects. Every year, 6 or 7 get attached to One Health. They do work on waterborne diseases or antibiotic regulatory systems or vaccine supply chain. We team them up with public health, with veterinary medicine, other students. It's a very powerful transdisciplinary nature. The other one, which we think is very, of course, sustainability-wise, is it's not just about we, US universities or European, Canada, the North going to the South and giving training, but how do we build the future critical mass of scientists in the partner countries? We have had a long-standing partnership with NIH Fogarty International Center since 2010 and through 2023, and hopefully for the long range, we're building a research training manpower, PhDs and postdoctoral trainees that will really take care of their institutes. And again, we focus on needs assessment, institutional systems, but of course, those institutional system building comes through the professionals in the defined priority areas. And part of the sustainability is also, it's not just skilled manpower, but the system, the soft skills, adjunct skills, communication, leadership skills. How do we empower the trainees to become successful professionals in the future? In the associated infrastructure systems, the laboratory capacity, other aspects. So we emphasize those aspects. In addition, in the university ways, we do twinning type of programs in terms of having curriculums that are up to the standards in a globally relevant way. So those are a few things for now, but happy to discuss more later. Thank you.
Thank you. Just real quick, how have you been able to sustain some of your international collaborations and educational programs during COVID-19? How did you pivot?
Oh, COVID-19, in fact, made, in one hand, it's a big challenge for the world, a big opportunity for One Health. I have to say, it's a silver lining. The interest on One Health really took off significantly. We have never been busier than during COVID-19. In our case, we have people on the ground in a few countries, but particularly in East Africa. We cannot move from our home, but we were able to make impact through the number of people we trained previously. The number of people through NIH Fogarty we trained on, let's say, PCR or genomics are now the ones doing COVID-19 detections there. So it's been very powerful. So thank you.
Very, very good. And so I'd like to move to Dr. Gibbs, and I'll maybe start with my own kind of personal observation. I spent a lot of my career in government service, and unfortunately, I think most of you know there's a lot of silos in any organization and a lot of silos in government services as well. And boy, and I come to academia and I see a lot of silos. But we know, in fact, our students, next generation, know that the challenges we face and the challenges they're going to face in their lifetime require just multidisciplinary collaboration. Working across sectors is essential. So Dr. Gibbs, I'd like to maybe throw a question at you, and how is our academic community and how are our colleges, what do we need to do better in the academic community to make sure that our educational opportunities and degree opportunities can cross some of the traditional academic college barriers and boundaries?
Well, the first thing I would say is we need to disrupt the current educational paradigm around One Health, or shall I say not around One Health. So the current paradigm, when you're talking about undergraduate students, or for the most part, master's and doctoral students, is we train students to stay in their lanes. Now, the reason why we do that, unfortunately, is because of many aspects associated with that. There's politics involved, there's finances involved. For each one of our fields, there's also specific accreditation elements involved, whether you're nursing, medicine, veterinary, public health, ABET, and so on. So we don't have a lot of truly One Health integrated programs, and that makes it a little bit more difficult. When you take a look at public health curriculum or medicine and nursing curriculum, each one is structured around what they're trying to put forward. So medicine and nursing curriculum don't include a lot of epidemiology or items around veterinary issues. Public health curriculum doesn't allow a lot of room for impacts on the environment or on the impact of animal health. The current model of academic education mostly focuses on our own individual students. Just to use public health as an example, our focus tends to be on our students. Now, Dr. Parker, you know as well as I do, you, me, and a number of others, we're trying to create better collaboration across units, across colleges, and across schools. But it can be very difficult at times, even when you're talking about interprofessional education, which on the health side tends to be mandated. And unfortunately, interprofessional health education tends to be around mostly case studies or controlling for human health, and doesn't get into a lot of the stuff that we're talking about here with One Health. The other thing that I would mention that I think kind of gets overlooked, and I think is going to be even more important as we move forward, is the financial aspects of this at the academic institution. Many universities are either using what it's called responsibility-centered management or responsibility-centered budgeting, which then moves the curriculum and the credit hours associated with the revenue generated back to the school level. There's pros and cons to that. One of the con is it makes it more difficult for cross-unit collaboration. So if you're here in public health and you're wanting to do a course with vet med or the Bush School here at Texas A&M, then one of the questions is, how does that revenue flow back? You know, how does that impact? And that was important prior to the pandemic. During the pandemic, academic institutions have taken huge hits. Now, we're fortunate enough, myself and the other panelists, we're at very large institutions. 3 of the 4 of us are at land grant institutions. So for the most part, we can absorb a lot of this hit. But when you're talking about trying to extrapolate this down to the smaller or the mid-sized university or colleges, then that revenue flow becomes even more important. So what the takeaway I would say here is we really have to look at the funding models that we're utilizing for academic institutions, and look at whether or not that's best serving the people we need to produce and the students we need to produce, and have those conversations so that, you know, if we want to do a joint program or a joint curriculum with the Bush School or vet medicine, that it's easier for us to share that revenue. Because at the end of the day, a lot of people who sit in my chair, we want to push things forward as a dean of a school or a public college. You want to push things forward, but you're also very aware that you have 300-400 employees that you need to make sure that you have enough revenue to support. So that's something that I would say right there. Additionally, I'm a fan of accreditation. I'm a fan of competency-based education, but oftentimes, you know, public health accreditation doesn't talk to vet science accreditation, doesn't talk to medicine accreditation, and so on. And we develop these things, getting back to what you're talking about, in our own independent silos. So what I need to fulfill my accreditation, Dr. Mazet may need something similar, but if they don't perfectly line up, then it becomes really difficult for vet science and public health to work together to meet the same what's essentially the spirit of the law versus the actual competency that we have to make sure that we're hitting.
No, thank you. I guess at the end of the day, it all comes down to finances too often. And so we're going to have some disruptive thinking to overcome some of these challenges so that we can prepare the next generation. Because I'm confident they already know they have to get out of their silos and work across with other professionals and other disciplines, even outside of the broader health lane.
You know, they know it, they want to do it. And in some cases, you know, I'm not singling out any institution, definitely not singling out my own, but in some cases, the schools and the units de-incentivize it. So I've looked at some university programs where even when you get into the elective hours, which would be great because you want a public health student to go over and take a zoonotic disease at Epi or that pandemic course, that the wonderful pandemic courses at the Bush School, you know, they may be de-incentivized by locking the electives into the school when that may be simply just because of the revenue associated with it.
Well, maybe you and I here at Texas A&M, because I know there's an effort right now to collaborate with the School of Public Health and the Bush School on a kind of a combo public health and international affairs. And so that's something you and I can be a change agent, at least locally here, and maybe that'll be a model for.
Oh yeah, and our good friend John August over there at Vet Med, he's very much interested in One Health, and we've had some conversations on this while you were out saving the world with the federal government.
Just one comment that actually the public health accreditation, I think, has been the most progressive in One Health, in that it was the first time we saw in accreditation any comment that look like One Health. And so there's a core competency for public health accreditation that the students must be able to appreciate, acknowledge, and work on the intersection of animal, people, and environmental health issues. The plants didn't get into that one originally, but I think that's really positive. And the program that Prof. Aini mentioned, the CUGH, or the Southeast Asia One Health Alliance, and also AfriHUN, the Africa One Health University Network. Those two programs are coming together with us to start to propose some One Health accreditation, voluntary accreditation. So I think we might see our colleagues in the LMICs, who are really doing a wonderful job with their One Health accreditation, put forward to the world what they think are those minimum standards. So I'm excited to see that. And they have a lot of what I think is critically important, and planetary and environmental health in them.
Dr. Mazet, I would say thank you for mentioning that. I believe that too around public health accreditation. I just thought it would be a little bit self-serving if I were the one to mention it. So thank you for mentioning it. I did not put her up to that.
Actually, in Malaysia too, we are looking forward to work with Ideris, Mazet. And we are looking forward to the program the next coming years and so on. The first part was more of the training program, but the next level with Ideris, I think it's going to be very exciting.
Well, Dr. Ideris, while you're speaking, actually, can you share some of what you've done in the Malaysian One Health University network and trying to catalyze, additional interest from other agencies to get involved, and what are some of the things that have been successful for you, and catalyzing that broader interest?
Yeah, I think we've been very successful in getting other agencies to work together with the One Health group, mainly because, as I mentioned earlier, when we had the Nipah virus outbreak, it was a real tragedy to the country, and people start to work together. Before, as you mentioned, people work in silos. So the government agency will work there, even among ministries, they're not together, they're not collaborating very well. Ministry of Agriculture, where Department of Veterinary Services is, and Department of Ministry of Health, they're sort of working in isolation. But when the Nipah virus outbreak comes in, it gives them a big shock, and I think that they found that it is very important. So as the years go on, and this with the introduction of One Health, and we do a lot of program together with the ministries, together training the staff, and now with the COVID-19 coming in, and that also has created a lot of interest. So we have many agencies, many government departments, many agencies, and many other ministries that come in easily or voluntarily, and when we invite, there's no hesitation. Otherwise, we have people a bit reluctant to provide even to provide information, and it is very difficult to get information in certain areas. And now there is a move to, in fact, we are proposing to upgrade the One Health network at the national level. And we are proposing that it should be under the main umbrella where the disaster management and also the pandemic management have a subsection on One Health, so that these things will not be left behind. And it seems there's interest in that, and we're working on it, and hopefully that it will work out. I think the situation has helped us, and the activities that we have done together with the training the staff, training the staff at the ministry level, at the relevant agencies, that has created a lot of interest, and they are happy to be together with us. I think that's what we have done. A lot of modules. We have done a lot of simulation of disease outbreaks, and together with various groups and various agencies. And this has created a lot of interest and a lot of commitment to work together.
Very good. Thank you. And I'm going to take the moderator prerogative right now to jump to some of the Q&As that we have. We have some very interesting and good questions, and some of them are, really focused on, the student perspective and the career advice. I think I would like to take some time to address some of these. And I'm going to go to one here. I'm just going to read the question and open it up to the panelists. So I'm an MPH, Master's of Public Health, but it focuses on community health sciences with elective options. I've been told that I should just switch to a different focus area since I'm interested in more epi and disease outcomes. Is this a problem that a lot of universities face, being too single focused? Anybody want to take that?
I'll go ahead, Dr. Gebreyes. It looks like you had an answer there.
Go ahead.
So I'd be happy to take a look at this or to answer this. So when it comes to how various schools of public health and programs are structured, they do have their focus area. And now there's a broad range of things that you can do within those focus areas. I think too often what happens is students select a university because they want to go to Ohio State, or they want to go to A&M, or they want to go to UC Davis, and they don't select it based upon the strength of that program. I'm not saying that's the case with you, but if you find yourself in a situation where you get in and you're in your MPH or your early studies, and you find that you may be better suited for some, actually in many universities, it's not that difficult to change concentrations. So you could move from that community health concentration to an epidemiology concentration. Now, there's some paperwork and some steps to go through, but that's a possibility. Additionally, within most MPH programs, there's a healthy amount of electives built in, and this gives you the ability, in consultation with your advisor and others, to really expand your focus area. So if you want to stay within community health, but do more of that epidemiological slant that you mentioned there, you could pick up additional epidemiology courses and so on. Additionally, another option that I really like, and I encourage a lot of my mentees to look into when they come to me with a question like this is, for example, they're interested in the discipline they're in, but they also want to explore something else or get additional expertise in that, is graduate certificates, whether they're within the school you're at or within vet med or the College of Medicine or political science or some other areas. Oftentimes you can integrate those into your curriculum and use the courses overlapping. So if you can find a certificate that's in your area, I always think that's better for the student, because then they get an additional credential that goes on top of that MPH or on top of that other degree that says, I have a focus in this area. That'll help you more for future employers. But if you don't have access to that certificate, in consultation with your advisor, you can really expand the electives that you're taking at most institutions to allow you to dig deeper into those other areas that you're interested in.
So bottom line,
quick addition.
Go ahead.
Yeah, I think Dean Gibbs answered it very well. I just want to emphasize, I'm sure in all the panelists agree, that One Health, the goal is not to create another silo, right? But how do we work? These silos exist, departments, colleges, programs exist. One Health is a cross-cutting horizontal system. How do we work effectively to build a professional? So as Dean Gibbs said, there are various interdisciplinary programs. I don't advocate, and we don't advocate, anyone leaving from his or her own, focus or on MPH or PhD areas, but work through a system to gain the One Health competency knowledge. And often we built on a global One Health certificate program, interdisciplinary certificate, for example, at Ohio State. I'm sure there are many programs you can take advantage of. So thank you.
Yeah, I probably should have used a different word than silo when I introduced the silo concept, because often I use the word of cylinders of excellence. And actually, One Health is helping us build bridges between our cylinders of excellence. I want to go to one more student question real quick. And I'm an MPH in global health, seeking a career in epi and infectious disease research. What types of internships or extracurricular opportunities do you recommend for this career path? Anyone?
I don't want to hog all the answers there. Dr. Mazet, did you want to, I couldn't tell if you wanted to take it.
I can. I was trying to answer, just top up a little bit in the chat on that last one, because I don't want anybody to undervalue the power of the students as agents of change. And so I just want to make sure that the students know that their voices are incredibly powerful. It's actually how faculty are evaluated, and everything else is that we are listening. And community health, we often say in our program, everything begins and ends at the community level. So it's so important. So I just wanted to give a little shout out and encouragement there. As far as extracurricular or even intracurricular, what we found as being highlighted in our survey that I mentioned, the international survey, we actually had over 800 respondents in, I think, I have it up, but I think 13 countries, let's see, 66 countries. I don't want to undervalue our response. And the two things that came up as most important were having that disciplinary focus that we've mentioned. So if you are in a program that is One Health and is focusing on soft skills, some of them focus only on the very important soft skills. Make sure you get yourself some background, work with a professor, work in their lab or in their field project to make sure that you get a disciplinary focus as well. If you're in a program that's mostly disciplinary focus, reach across the lines, organize symposia, make sure you're breaking down those silos. You're building your own cadre of connections across disciplinary lines. But the two important things that came across from that one was, please, make sure you have the disciplinary focus. And number two is to have a hands-on training program. So make sure that you have if it's not part of your program, which it was missing from many, if you don't have a capstone or some sort of research hands-on program, make sure you make that for yourself. Do it in your summer, figure out how to take a quarter semester off to do that, because that was seen as most important by the graduates as well as the employers, knowing that the students were coming with that hands-on experience.
Any others? Actually, this will probably go to Jonah as well. I want another question from a student, and we're going to go back to some of the some other questions as well. But as a veterinarian trying to transition to public health, public policy, I have been met with many hurdles. While a medical degree or dental degree may meet the criteria for employment opportunities, I often find a DVM does not. Due to the debt incurred in going to veterinary school, what would you recommend?
Yeah, I mean, this is tough. And this is where it comes back to some of what Dean Gibbs mentioned and others, is that, learning the project management skills, the communication skills, the collaboration skills, as I mentioned, that was one of the top things expressed, was being able to manage or contribute to a multidisciplinary team. Some people are just naturally oriented to that, and others might need to seek out some additional help. And I am thrilled to see there are some short courses and certificate programs. In Davis, we actually do one, but there are others. We have what we call RX One Health, or the prescription for a better health for the planet and for people. We usually offer that in Tanzania. We had to cancel it last year, but we are going to be offering it in California this year, and then hopefully back in with another partner in either Tanzania or another international site. So that is a really nice one, because you get those soft skills, but you also are in a cadre of different disciplinary background, junior and mid-career professionals, and students are also eligible if they're in a graduate program. So then you go on, I see their WhatsApp groups, and they stay connected forever, and they're building that network while learning those collaborative and project management skills.
The other thing that I would add in there, particularly to Sam's question here, is I wouldn't necessarily assume that them not listing a DVM means you're not qualified. One of the things that I've seen when talking to people about a lot of position descriptions over the years is unfortunately sometimes the DVM gets overlooked as they're thinking about terminal degrees. So what I would recommend is if it's a position description that you feel you're qualified for and meets your needs, I would apply for it, listing your DVM. And in my first paragraph of the cover letter, I would acknowledge that you have a DVM, and I would make your case. So I wouldn't necessarily see it not being listed as exclusionary.
Sorry, and I might not have understood the question. I wasn't reading it as we were going, so thanks for that top up. But that was something we found when I said there was a disconnect between employers and job seekers, is that the job seekers seem to want to see their disciplinary degree listed. And the employers felt like they weren't getting qualified applicants. So the job seeker said, there's no jobs for me. And the employers say, I can't find any qualified applicants. And so that disconnect really has to do with, as you said, Shawn, selling yourself and your skill set, whether or not you think you're a perfect fit, you may be the best candidate. So go ahead and reach out and apply.
Yeah, I think there's been a message from several of us for the students in the audience is you really have to kind of take control of your own destiny, and don't let past norms be a limitation to where you want to take your career, and you may have to think outside the box and get some new experiences. And I would say the opportunities for the veterinarians in the audience are tremendous. But you may have to think outside the box. You may have to get some international experience with an NGO or whatever. You just need to think outside the box, but the opportunity is it is unlimited potential. I want to go back actually to Dr. Gebreyes a little bit, and thinking about your observations. What are some of the One Health educational training programs that you've been involved in and have been most impactful?
Great, thank you so much. Sorry for the human-animal interface here, so you will continue to hear some dog barking. Thank you so much. I think there are lots of excellent, impactful programs, but when we say impact, often we tend to focus on the immediate outcomes or outputs and some shorter-term outcomes rather than the impact. Often, measuring impact might be challenging, but I can give you examples. In fact, using Ohio State and Ethiopia partnership, where the Ministry of Health identified priority areas such as rabies. Rabies is a major killer, still estimated more than 2,000 people, majority children, die in Ethiopia. When Ohio State approached and asked the government, what are your priorities? What can we work on? The government identified priority areas, and we identified one of the One Health model as a rabies, right? So I think first is, is that program, I can give you more of the success, but, it's built up on the need on the ground. Second, based on expertise that we have, that has multidisciplinary expertise. I think immediately about, professionals from 7 colleges were involved on this rabies. Rabies as a grassroots problem, but we use it as an opportunity not only to make a grassroots impact, but also to use it for training the future professionals, right? Rather than a dry didactic training, it became impactful and integrated system. So through that program, there were a number of working groups identified from the heavy involvement of the academic, research, regulatory systems of the government, large number of dogs vaccinated, children's lives saved. I think up to now there are 86,000 dogs vaccinated within the capital city of 4 million plus people. Quantifying how many child's lives saved is difficult to get to the impact. But a number of surveillance officers trained, a number of laboratory infrastructures built, And that One Health model, a national One Health model, was established for the country. That is exactly the model currently used for COVID-19 to mitigate COVID-19 in the country. So this is really, again, the capacity building is not just about the training, but it needs to have that holistic approach. So that's why we are always proud of that, but also a long way to go. So it's now helping out a lot on COVID-19, and very thankful with our partnership with CDC, by the way, because in the midst of this work, the global health security agenda, which, Jerry, you are a key part of the inception of global health security. We're still implementing through global health security agenda, which is very much critical. So thank you.
Thank you. And Dr. Iditiris, what would you say are some of the most impactful outcomes from your work in the university network you've been associated with?
Okay, well, I think the most impactful things that we have seen with the network is that when, for example, when this COVID-19 comes in, and the academy and also the Ministry of Science wanted volunteers to look into the vaccine, preparation of vaccine and work of the vaccine. We have the group, they are, they're already there because the network is already quite well firm up in terms of who we know who they are and who to approach and how to come in. And I think that's very impactful because we now have groups that come and volunteer. Okay, we can do this. We can help the country to do this. A lot of the volunteer through the network. Just we pointed out through the network that we need this kind of assistance for the country, and people come and running in, and because we know who are involved and everybody is involved in this area. And also because a lot of the workshops, training program that we have held for the workforce as well as for the community. We have done some training program for them to understand the importance of zoonotic disease, the importance of epidemics, how to control, how to prevent, what are the things that need to be done. So it is quite very, very quickly people can understand. I think that is very impactful. Otherwise, it is very difficult to get people together, to work together and to come up with a good proposal to do some research and to come up with the new ideas to propose to the government.
Thank you.
Could I
Go ahead.
just say that I think the programs that Prof. Aini is highlighting that also were throughout Southeast Asia and Africa have been instrumental. The trainees as well as the leadership have been instrumental in the COVID-19 pandemic. We've seen them be both first responders, but also on their national task forces. And actually through the ECHO platform, we were able to reach and train in the early days of the COVID pandemic, 20,000 trainees in One Health for COVID integrated thinking and response. So it's been incredibly productive.
We are quickly running out of time. In fact, we only maybe have 2 minutes. And so what I would like to do is give each panelist an opportunity to give the students, the next generation that are attending, maybe your single most important message in a kind of a lightning comment as they think about careers and career pathways and how they need to think about their career journey to help solve the problems that they're going to face in their lifetime in a One Health context. So Dr. Gibbs, I'm going to go to you first.
I think I'd go back to the earlier theme that we were talking about, which is you can be the driver, you can be the change, you can really make a difference here. We pay attention to what students are interested in, just as we pay attention to what employers are are interested in. So essentially, you're voting with your feet as to what your interest areas are. Additionally, I noticed in the comments there's a number of DVMs and others who are looking to transition but feel limited by how they started. I'd use myself for example. I'm the dean of the School of Public Health here at Texas A&M. I have 0 degrees in public health. I have never attended a school of public health. I got my undergraduates from over there with Gebreyes, well, not with him, but at his institution at The Ohio State University. I did my master's and doctorate in environmental engineering and environmental science, and I did my MBA in agribusiness. So you can really drive your own path, and don't be afraid to drive your own path. And when you're looking at a position description, and if it doesn't look exactly like you, still apply.
Dr. Gebreyes?
Great, thank you. So just to complement further with what Shawn said is really, I would like to encourage you, be open-minded. Again, we say transdisciplinary, but definitely, you know, we are very much closer than what the silos, the departments, the colleges put us, really. Everything you do in your own respective profession has some relevance to the other one. So be open-minded, be connected, be globally engaged. Really, the best lesson I learned about One Health is before I heard about One Health. When I was a veterinarian practitioner in Borana, Ethiopia, South Ethiopia, 25 or 30 years ago, that we live in, the pastoralists know, they already have been doing for centuries in One Health practice. So be engaged and involved internationally, but globally, which means starting from the local. We have quite a few local Amish community projects, for example, on food safety others. So be globally minded. Again, in terms of the disciplinary, I want to emphasize, we have in our East Africa office, for example, we have about 110 or so employees on the ground. There, the person in charge is a physician. I am a veterinarian. He's a clinical trial and some expert on tuberculosis, HIV. I am a veterinarian with salmonella. It's not about a discipline, but the commitment and the motivation to make a difference. We work so wonderfully with our physician colleague in Africa, for example. So thank you.
Thank you, Dr. Mazet. And real quick, we're out of time.
Yeah, I know we're out of time, and I agree with what the others said, but if I could just top up with saying, make sure you recognize that everything is interconnected, and what we're doing to the planet is impacting our exposure to emerging infectious diseases, but it's also, those are the same drivers for climate change. Those are the same drivers for other major environmental disruption that affects our health and the health of the planet. So be that agent for change and for good.
Thank you. And Dr. Ideris?
Yeah, I agree with all the panel. It's very important for them to be very passionate about what they want to do. And it is not the degree that is important. You can go, and the degree that you get, whatever is degree you get, that is the basis. It's just the basis, and it gives you a firm, a place, a platform where you can reach out everywhere else. I think people work with different degree, but work in the bank or work in other areas, and you are a scientist. You know, it is not something that is not possible. To me, the degree that we get is the ground for us to move forward and not be afraid to move forward. It is all multidisciplinary, multisectoral. It's very important. Just be passionate about it, pursue what you want to do. I think you'll get it.
No, thank you. And I'll just add one word: be passionate about it. These are the One Health interface and the problems that we're trying to solve with the One Health approach. It's very easy to get passionate about it, and I just recommend that you find something you're passionate about, and it won't be work. It'll be an exciting career. So with that, I want to thank all of our panelists. This has been a very good discussion. There are a lot more questions that we haven't had a chance to get to. What we will try to do, if we can, if the organizers can make sure that we have all the questions and another chat, we'll try to do some email feedback on the remaining questions that are still outstanding. So with that, we conclude this panel, and I thank everybody for participating, and again, thank the panelists for their very valuable questions. Thank you.
Thank you.
Thanks, Jerry. Thanks, everyone. Good to see you.